Sweating is a normal part of life. It cools your body, responds to heat and exercise, and helps you regulate temperature. But when sweating becomes excessive, even at rest, in cool environments, or during the night, it may signal something deeper. This is especially important for older adults because our bodies change with age. Hormones shift, nerves slow down, and the immune system becomes less responsive. When sweating starts to happen out of rhythm with your activity or environment, it's worth paying attention. Before we dive in, make sure you hit subscribe and tap the bell. This channel is here to guide seniors with honest, practical health tips you can trust, and you won't want to miss what we're about to reveal. Let's explore 8 conditions that could be hiding behind excessive sweating, particularly in seniors. 1. Overactive thyroid, hyperthyroidism. One of the most common reasons for unexplained sweating is an overactive thyroid. This tiny gland in your neck controls metabolism. When it speeds up, your whole body does too. That means sweating for no reason, a racing heart, nervousness, unintentional weight loss, and restlessness, even when sitting still. One of my patients, Evelyn, age 71, came to me concerned about night sweats. She thought it was just lingering menopause, but lab tests showed a mild thyroid imbalance. After adjusting her medication, her sweating improved, and for the first time in months, she slept peacefully through the night. If you're finding this helpful so far, type "cool" in the comments. It shows us you're engaged, and it really keeps us motivated to bring more life-saving tips. 2. Infections or chronic inflammation. Sweating can be a subtle sign that your immune system is fighting something off. Conditions like tuberculosis, HIV, or hidden bacterial infections can cause night sweats, even without a fever. In older adults, infections often present differently, no high fevers, but persistent sweating and fatigue. If you're sweating without an obvious cold or flu, especially at night, it's time to speak with your doctor. 3. Diabetes and low blood sugar. Uncontrolled diabetes or sudden drops in blood sugar, hypoglycemia, can cause sudden sweating, shaking, and dizziness. Over time, diabetes can affect the autonomic nervous system, which controls sweat glands. You may notice you sweat heavily while eating or even while watching TV. If you're diabetic and this sounds familiar, your blood sugar may need adjusting. 4. Hormonal changes, andropause and menopause. Hormones naturally decline with age. Men experience andropause, a drop in testosterone, and women go through menopause. Both can cause hot flashes and sweating, especially at night. These changes may appear gradually or feel sudden and intense. Emotional triggers, like stress or anxiety, can amplify the symptoms. I remember Harold, 68, who came in worried he had an infection due to his constant sweating. But his labs were clear. The real issue was hormonal imbalance tied to low testosterone. After reviewing options, he made a few small lifestyle changes and felt more in control within weeks. Are these insights making sense so far? Type 1. If this is helping you understand your body better, and hit the like button so we know you're here for more. Let's keep going. 5. Cancer, especially lymphoma or leukemia. While rare, some cancers, particularly lymphomas, can cause severe night sweats without fever or weight loss. These are considered B symptoms and are especially important to monitor in older adults. If you're waking up drenched more than once a week and can't find a cause, ask your doctor to investigate further. 6. Anxiety and panic disorders. Sweating can also be a stress response. Anxiety activates the sympathetic nervous system, leading to sudden sweat, a racing heart, and a sense of panic. even when nothing external is wrong. Some seniors experience anxiety for the first time in retirement, especially when facing loneliness, loss, or health changes. If you find yourself sweating in social situations or when overwhelmed, it could be more than nerves, and it's treatable. 7. Medications and drug withdrawal. Many medications, including antidepressants, hormone therapies, and blood pressure drugs, list sweating as a side effect. In some cases, stopping medications like alcohol, opioids, or sedatives can also trigger night sweats and daytime sweating. Don't stop any medication on your own. If sweating starts after a new prescription, talk to your doctor. 8. Heart and circulatory diseases. Cold sweats, especially if paired with chest pain, shortness of breath, or dizziness, could indicate a heart attack or circulatory problem. Even chronic heart disease may cause night sweats, fatigue, or leg swelling, especially in seniors. If you're over 60 and notice new sweating episodes alongside heart symptoms, get checked immediately. Final thoughts for seniors. Sweating isn't always harmless, especially in older adults. If your sweating feels sudden, excessive, or unexplained, your body could be warning you. Stay hydrated, track your symptoms, and never ignore night sweats or chills that don't fit the situation. Pause for a moment and hit subscribe if this helped you better understand your body. These small signs often carry big messages, and we're here to walk with you through them. We love hearing from you. What part of this video helped you most? Drop your thoughts or stories below, and please share this with someone you care about. Your comments inspire us to keep making clear, compassionate health videos for seniors.